This morning, before you poured your first cup of coffee, before you opened the curtains, before you even checked your phone, you probably swallowed one tiny blood pressure pill. Maybe it was Amlodipine, maybe Losartan, maybe Lisinopril. It took less than 5 seconds. But have you ever stopped and asked yourself, what is this pill actually doing inside my body? Because after treating older adults for decades, I've learned something surprising. Most seniors know the name of their medication. Very few know what it is actually doing. And that lack of understanding creates fear. Fear when the ankles swell. Fear when a dry cough won't go away. Fear when dizziness appears after standing. Fear when the blood pressure machine suddenly shows a different number. Many people assume, I'm just getting old. But sometimes your body is trying to tell you something much more important. Let me tell you about Margaret. She was seen 23 years old, independent, still gardening every morning, still driving herself everywhere, still refusing help from anyone. One afternoon, she noticed her shoes felt tighter. By evening, her socks left deep marks around her ankles. She stared at her legs and immediately thought, my heart must be failing. Instead of calling her doctor, she quietly stopped taking her medication every other day. 3 weeks later, her blood pressure reached dangerous levels. The swollen ankles were never the real problem. The misunderstanding was. And unfortunately, Margaret is not alone. Thousands of seniors make medication decisions based on fear instead of information. That is exactly why we're having this conversation today. Before we begin, tell me something in the comments. How old are you? And which medication do you take? Amlodipine? Losartan? Lisinopril? Or something else? Someone reading your comment may realize they aren't facing these questions alone. And if you enjoy simple medical explanations without confusing terminology, subscribe and join us every week. Because understanding your body is one of the best investments you can make for healthy aging. Number 1. These 3 medicines lower blood pressure, but they work in completely different ways. Many people believe blood pressure medications are basically identical. They are not. Imagine your circulatory system as an enormous city full of highways. Your heart is the central station. Your blood vessels are the roads. Your blood is the traffic. High blood pressure happens when traffic becomes difficult to move. But each medication solves the problem differently. Amlodipine. Think of your arteries as flexible garden hoses. Inside their walls are tiny muscles that tighten and relax all day. Amlodipine helps those muscles relax. When the muscles loosen, the arteries become wider. Blood flows with less resistance. Your heart doesn't have to push as hard. Blood pressure falls naturally. Simple. But here's something many seniors never hear. Because those blood vessels relax, blood can sometimes collect more easily in the legs and feet. We'll discuss why that happens later. Losartan. Losartan works differently. Your body constantly produces chemical messengers. One of those messengers tells blood vessels, tighten up. Losartan quietly blocks that message. The messenger is still produced, but the blood vessels never receive the instruction. As a result, they remain more relaxed. Blood pressure decreases. Lisinopril. Lisinopril goes one step earlier. Instead of blocking the message, it reduces the body's ability to produce that message in the first place. Less signal, less tightening, lower pressure. 3 medications, 3 different pathways, 3 different sets of possible side effects. Understanding this one idea alone explains why 2 neighbours taking different blood pressure pills can have completely different experiences. Number 2. The goal is not just lower numbers. Many seniors become obsessed with one thing: the monitor. They check it after breakfast, after lunch, after dinner, after walking, after watching the news, after arguing with family. Every reading creates anxiety. But blood pressure isn't supposed to stay exactly the same. It changes every minute. Standing up changes it. Walking changes it. Stress changes it. Pain changes it. Even thinking about your blood pressure can increase your blood pressure. Imagine checking the weather every 5 minutes and becoming frightened because clouds appeared. That isn't how weather works, and it isn't how blood pressure works either. Doctors don't look for one perfect number. They look for consistent patterns. One unusually high reading rarely tells the whole story. One unusually low reading rarely tells the whole story. The trend matters much more than the moment. Let me introduce Harold. He was 79. Every time he felt nervous, he checked his blood pressure. Sometimes 20 times a day. Every high reading made him more anxious, which pushed the numbers even higher. He thought his medication had stopped working. After reviewing his routine, we asked him to measure only twice a day. Morning, evening. Same chair, 5 minutes of rest first. Within 1 week, the frightening pattern disappeared. Nothing had changed except the way he measured. The medicine was working all along. Number 3. Your body changes after 60 and your medication changes with it. One of the biggest misconceptions is believing the body at 70 behaves like the body at 40. It doesn't. As we age, our kidneys filter differently. Our liver processes medication differently. Muscle mass decreases. Body water changes. Blood vessels become less elastic. Even balance changes. The exact same dose that feels perfectly normal at age 50 may cause dizziness at age 75. That doesn't automatically mean the medication is wrong. It means your body has changed. Which is why regular follow-up appointments matter so much. The prescription isn't the end of the conversation. It's the beginning. Consider Evelyn. At 62, she could stand up instantly, no problems. By 76, she noticed occasional dizziness every morning. She assumed, I'm just getting older. But after reviewing her routine, she realized she was taking her medication and immediately rushing into the kitchen without drinking water. A few small adjustments completely changed how she felt. Sometimes the solution isn't a stronger medicine. It's understanding how your body has evolved. Have you ever looked at your feet in the evening and wondered, why do my shoes suddenly feel tight? Or maybe you've developed a cough that simply refuses to disappear. You drink warm tea, you take cough drops, you blame allergies, you blame the weather. But what if the real reason is sitting inside the little pill bottle on your kitchen counter? Today's conversation is about the things that surprise seniors the most. Not because they're rare, but because nobody ever explained them properly. Let's continue. Number 4. The swollen ankles that frighten thousands of seniors. A few years ago, I met Robert. He was 74 years old. Every morning he walked 2 miles around his neighborhood. One evening he noticed something unusual. His socks left deep marks around his ankles. By bedtime, his feet looked almost twice their normal size. He immediately thought, my heart is failing. So he did what many seniors quietly do. He skipped his blood pressure medicine, then another dose, then another. Within 2 weeks, his blood pressure climbed above 180. The swelling wasn't what put him in danger. Stopping the medication did. Why does this happen? Imagine your blood vessels as highways. Amlodipine relaxes the small arteries extremely well. Blood flows into your legs more easily. But the tiny veins don't relax to the same degree. so fluid can temporarily collect around your ankles. Gravity makes it even more noticeable. That's why many seniors notice shoes fit perfectly in the morning, ankles look larger by evening. Swelling improves after sleeping. This pattern is actually very common. What should you do? Don't panic. Don't throw away your medication. Don't reduce the dose on your own. Instead, talk with your physician. Sometimes adjusting the dose, sometimes changing the time you take it, or sometimes switching medications completely solves the problem. Information leads to solutions. Silence creates unnecessary fear. Small daily habits that can help. If your doctor approves, try these simple habits. Walk for 5 minutes every hour. Avoid sitting continuously for long periods. Elevate your feet while watching television. Stay physically active. Movement acts like a natural pump that helps blood travel back toward the heart. Number 5. The dry cough that nobody connects to their medication. Let's talk about Susan, age 68, healthy, active, never smoked. She developed a tiny tickle in her throat. Nothing serious, just annoying. Weeks passed, then months. Every night she coughed. She bought humidifiers, changed air filters, stopped drinking cold water. Nothing helped. One day during a routine visit, she casually mentioned, "I've had this cough for about 4 months." The first question was simple. "When did you start Lisinopril?" She looked surprised. "About 5 months ago." Suddenly, everything made sense. Why does it happen? Lisinopril increases certain natural substances inside the lungs. For some people, those substances irritate tiny nerve endings. The result is a dry, persistent, non-stop cough. Usually there is no mucus, no fever, no infection, just a cough that refuses to leave. An important point. Some seniors develop the cough after a week, others after 6 months. Some never experience it at all. That is why many people never realize the medication may be responsible. But there is one symptom you must never ignore. A dry cough is uncomfortable, but swelling of the lips, tongue, face, or throat, especially with difficulty breathing, requires immediate emergency medical care. Although uncommon, it can become serious very quickly. Knowing the difference could save a life. Number 6. The hidden potassium trap sitting in your kitchen. Let's play a little game. Open your pantry. Look at the labels. You may discover something surprising. Many products proudly advertise heart healthy, low sodium, salt-free. Sounds wonderful. Until you notice one ingredient: potassium chloride. Why does this matter? Losartan and Lisinopril can increase potassium levels in the body. Potassium is essential. Your muscles need it, your nerves need it, your heart absolutely depends on it. But too much potassium can disturb the heart's electrical rhythm. And the frightening part? Many people feel almost nothing. Others notice only muscle weakness, leg cramps, unusual fatigue, or occasional skipped heartbeats. Meet George. George was 76. Trying to improve his health, he stopped using table salt. Instead, he switched to a healthy salt substitute. He also drank electrolyte powders every afternoon. He believed he was making perfect choices. Months later, his blood test showed potassium levels far above normal. His medications weren't wrong. His intentions weren't wrong. He simply didn't know they were interacting. Never assume that natural or heart healthy automatically means safe. Always ask your healthcare professional before regularly using salt substitutes, electrolyte drinks, potassium supplements, or meal replacement products. One simple conversation may prevent a serious problem. Number 7. The medicine in your bathroom that can quietly cause trouble. Most seniors don't think twice about taking ibuprofen for knee pain or naproxen for back pain. They're sold everywhere. No prescription, no warning bells. But here's something many people never hear. Imagine three friends trying to carry a heavy sofa upstairs. One person suddenly lets go. The remaining two now struggle much harder. Your kidneys work in a similar way. Blood pressure medications carefully regulate blood flow. Certain pain relievers can temporarily change that balance. For some seniors, especially when dehydrated, the combination may place extra stress on the kidneys. Dorothy's story. Dorothy loved gardening. Her knees hurt every evening, so she took ibuprofen almost every day. She never mentioned it during appointments because it's just something I buy at the pharmacy. Routine blood work later showed declining kidney function. Once her medications were reviewed, the missing piece became obvious. No one product caused the issue alone. It was the combination. A simple habit that can protect you. Every time you buy a new over-the-counter medication, ask one question. Is this safe with my blood pressure medicine? That 30-second conversation can prevent months of complications. Number 8. What happens when you get sick? Imagine this. You wake up with a stomach virus. You've been vomiting. You haven't eaten. You haven't kept water down all day. Morning arrives. Your blood pressure pill is waiting beside your coffee cup. Should you automatically take it? Not always. Blood pressure medications are designed for a body with normal hydration. But illness changes everything. Less fluid means lower blood volume. The same medication that worked perfectly yesterday may lower blood pressure much more than expected today. Some seniors suddenly feel lightheaded, weak, unsteady, or close to fainting. Frank's experience. Frank was 78. He had never missed a single dose in 3 years. Then he developed severe diarrhea. Even though he could barely drink water, he proudly took every medication exactly on schedule. That evening, he stood up and collapsed onto the couch. Fortunately, he wasn't seriously injured. But his body was simply too dehydrated for the usual routine. The better approach. If you become significantly ill, especially with vomiting, diarrhea, or inability to drink fluids, contact your healthcare provider for individualized guidance before continuing your usual routine. Every situation is different, and getting advice early is always safer than guessing. Before we finish, I want you to imagine two seniors. Both are 72 years old. Both take exactly the same blood pressure medication. Both see the same doctor. Both have the same diagnosis. But 5 years later, one is hiking with grandchildren, travelling, enjoying retirement and feeling energetic. The other is constantly worried, checking blood pressure 20 times a day, avoiding activities and living in fear of every small symptom. What made the difference? It wasn't luck. It wasn't expensive treatment. It was understanding. Because knowledge changes behaviour, and behaviour changes health. Let's finish with the most important lessons every senior should know. Number 9. Your blood pressure medication is a partner, not a cure. This is probably the biggest misunderstanding I hear every week. People say, "Doctor, my blood pressure is normal now. I think I don't need the medicine anymore." It sounds logical. But let's think about it differently. Imagine your house has a smoke detector. Every day, it quietly protects you. One day you realise there hasn't been a fire for years. Would you remove the smoke detector because everything seems fine? Of course not. The reason everything seems fine may be because the protection is working. Blood pressure medication works the same way. For many people, it controls the condition. It doesn't erase the reason the condition developed. What happens inside the body? High blood pressure develops over years. Blood vessels gradually become less flexible. Hormonal systems become more active. Lifestyle factors accumulate. Stress, aging, genetics, sleep, diet, and physical activity all contribute. Amlodipine, Losartan, and Lisinopril help manage those changes. But they cannot reverse decades of aging by themselves. That is why lifestyle still matters. The daily habits that make medication work better. Many seniors ask, what food should I avoid? But perhaps a better question is, what habits help my medication succeed? Let's look at them one by one. Walk every day. You don't need a marathon. You don't need expensive equipment. Even 20 to 30 minutes of comfortable walking improves circulation. Movement keeps blood vessels flexible. It supports heart function. It improves balance. It also improves mood. The body was designed to move. Sleep is more powerful than many people realize. Poor sleep increases stress hormones. Those hormones naturally tighten blood vessels. Your medication spends the next day trying to undo what one bad night created. Improving sleep doesn't replace medication, but it certainly helps it work more effectively. Drink enough water. Many seniors intentionally drink less because they don't want frequent bathroom trips. Unfortunately, dehydration can increase dizziness, affect kidney function, and make blood pressure readings unpredictable. Unless your physician has advised fluid restriction, consistent hydration remains an important part of healthy aging. Reduce stress without chasing perfection. Stress is part of life. Nobody lives stress-free. But constant worry keeps the nervous system activated. Deep breathing, gardening, reading, prayer, walking, talking with friends, listening to music. Simple activities calm the body and allow medication to work alongside a healthier nervous system. The biggest mistake seniors make. It's surprisingly common. Someone feels better, so they stop taking medication. Or they notice one side effect and quietly stop without telling anyone. Or they see one normal blood pressure reading and decide everything is fixed. Unfortunately, blood pressure often rises silently. No pain, no warning, no obvious symptoms, until suddenly there is a stroke, a heart attack, or kidney damage. Consistency is one of the greatest gifts you can give your future self. Should you take your medication morning or night? This question appears thousands of times every month. The honest answer is simple. There is no universal schedule that works for every person. Some medications fit naturally into morning routines. Others may be recommended later in the day depending on the individual's health, other medications, and medical history. What matters most is consistency. Take it at the same time every day. Create a routine. Use a pill organizer, set a reminder, attach it to another daily habit like brushing your teeth or breakfast. Missing doses repeatedly creates much bigger problems than choosing morning versus evening. Why home blood pressure monitors sometimes cause anxiety. Linda bought a beautiful digital monitor. Within a week, she was checking her pressure every 30 minutes. Every number controlled her emotions. 145, panic. 132, relief. 150, panic again. Eventually, she realized she wasn't monitoring her health anymore. She was monitoring her anxiety. Her doctor suggested a different routine. Morning. 5 minutes of quiet rest. Feet flat on the floor, back supported. No coffee immediately beforehand. Same arm, same chair. Record the number. Continue living your day. After 1 month, the readings became meaningful instead of frightening. Remember, one number is a photograph. A series of numbers becomes a story. Doctors treat the story, not a single photograph. A conversation every senior should have. At your next appointment, consider asking these simple questions. Why was this medication chosen for me? What side effects should I expect? When should I call the office? How often should my kidney function be checked? Should I avoid any supplements or over-the-counter medications? Are there lifestyle changes that could support this treatment? Patients who ask questions become partners in their healthcare, and partnership almost always leads to better outcomes. Several years ago, I met Samuel. He had just turned 80. He carried a notebook everywhere. Every appointment, every medication, every blood pressure reading, every question was written inside. He smiled and said, "I may be getting older, but I refuse to stop learning." One afternoon he looked at me and asked, "Doctor, what is the most important thing you've learned after treating people for so many years?" I thought for a moment. Then I answered, "The healthiest seniors aren't necessarily the ones taking the fewest medicines or the most medicines. They're the ones who understand their bodies and work with them instead of fearing them." Samuel nodded, closed his notebook, and said something I'll never forget. "Information lowers my blood pressure better than worry ever could."